Hi, Dr. Motwani here. I'm showing you a case here of a patient with LASIK-induced ectasia and likely worsening from what I could get from history over time. He was actually progressing, and you can see what's happened is the whole thing is bulging forward here and bulging forward here. So this is a fairly significant ectasia case. His best correction was getting to about 20/30. You can see he's a bit more regular in the center, so you can get to 20/30 with quite a bit of astigmatism, 3 diopters and 5 diopters. He'd had LASIK and he'd had laser enhancement, so sort of worsened the scenario. You know, he had a LASIK enhancement. And what we've done is we've gotten his corneal shape far, far better. The ectatic cone is way, way, way down. The problem is the residual parts left of the cornea to get it are fairly flat. So he's still kind of hyperopic, but his astigmatism is way down. So he's got a nicer 20/30, he's 22 months later, but the problem, he's about a +4 and a +3, but with very little astigmatism. Now, we know that +4 and +3 is not ideal. We expect it to drop as he heals. If not, it is possible to do laser where we're losing laser on the outside for the +3 and +4 down the road because there's more tissue out here. This is not where he had the ectasia. It's not where he's thin. It's not really where he had the original laser done. And we should be able to help him down the road in about a year or so with these kind of +4, +3s. But for now, he can at least wear a pair of glasses and see pretty well. And this should continue to heal and get better.